Hello.
Hello.
That was quite fun.
You have a lot of patience.
You did well on that test.
Yeah, I didn't check my score until after I hung up, and then I was like, yes.
Yes, it was nice. Yeah. All right. So let's do this first. Emily. Oh, we need Meredith. Okay. All right, girls, I'm not going to spend a lot of time on this right now. I just wanted to go through before we start our lecture, because we're kind of on a time constraint here today. So I want to make sure when you're doing your clinicals that you guys are doing everything by the rules, okay? So no shortcuts. If you're doing a procedure, make sure you're wearing the right PPE for that procedure, okay? Because what could happen is if you're not doing the thing, you could actually be asked to leave the program. So we need to make sure that we're doing the right stuff. The other thing I want to say is I am not comfortable, and I hope that you guys are not comfortable in doing something that you haven't actually done before, okay, and been checked off. So if you're asked to do a procedure and you're in there by yourself or Miss Teresa's not with you, I personally would be doing, I would be asking for her to come in and watch you do that, okay? So make sure that if you're not comfortable with something, make sure that she's checking you off on that stuff. Does that sound good?
Yeah.
It kind of was brought to my attention that maybe we were not doing the proper PPEs at all times. So we need to really make sure we're doing that, okay? Because I would hate to see that you guys have come this far, and they would ask us to leave the program. So we don't want that to happen, okay? All right. So you guys all sent me stuff on the phone about what you thought the proper PPEs are. Of course, right now you're having to wear that mask all the time, aren't you? So that's a given. But normally, a lot of these things you wouldn't have to wear a mask if we weren't in this whole COVID situation, correct? Okay.
Yeah.
All right. So I'm not going to spend a lot of time. I think this is something you guys need to do as far as making sure you're going through your skills. In your other book that we had from the nursing assistant book, and make sure you're knowing what you're doing. Again, ask questions. Make sure that if you are unfamiliar with it, you're asking questions, you're having somebody in there with you at all times to help you walk through it. This is your teaching time, okay? So I don't think that I, as your professor, would expect you to walk in and know how to do everything right. This is your time to be taught in a clinical situation, okay? So please, please, please make sure that if you have a procedure, that you're grabbing Teresa to help you do those. And please make sure there shouldn't be really anything you're doing that you're not wearing gloves with, okay? Everything we do pretty much we wear gloves, right? You wouldn't be doing a urine without a glove. You wouldn't be doing, let's say, oh, even just a plain old finger stick for a glucometer. You've got to make sure you have gloves. Does that sound right? Okay. So again, I'm not going to go through all of this stuff in this book again, but just know that pretty much you've got to wear gloves at all time, and you guys are wearing masks at all times now, so you know that's covered too. Now, if you're getting into something that is potentially dangerous, as spraying in your face, either be it blood, sputum, or even through an airway, you're going to be wearing a mask and maybe even goggles, right? But just make sure, just to make me feel better, that you guys are doing everything you can to do everything appropriate. Follow the protocol. And for goodness sake, if a patient says to you, oh, that's not how it's usually done, stop and go get somebody to help you. Okay? All right, let's get going. We're going to do chapter 18 today and 19. Emily, if you do indeed have to exit before we're done, just know that we have another test on Thursday. Okay. All right. And it's going to cover, let me find it. It's going to cover 16, 17, 18, and 19. But we'll try to review that at the end. All right, girls. So quality phlebotomy, chapter 18. All right.
I'm gonna sign in on my computer because my phone's about to die.
Do that, and then everybody go ahead and mute, because I'm still getting feedback too. There she is. Okay, we should be ready now. Get her on board and we'll get going. There you are. Okay. Are you still there? Okay, there you are, Emily. Okay, so quality phlebotomy refers to a set of policies and procedures designed to ensure that you guys are giving the highest quality of patient care, okay? This ensures better patient care by reducing errors and increasing efficiency. So this is kind of what I was just talking about. There's protocol in place so that we keep everybody safe, and we're doing the test appropriately. So remember, anything that I've highlighted, it's a good possibility it's going to be on some kind of quiz or test, okay? So make sure you make note of that. Quality control refers to the quantitative methods used to monitor quality of procedures, such as regular inspections, calibration of equipment, and to ensure accurate tests. So quality control is when you've got to make sure that everything's running appropriately before you even do a test, okay? QC is part of quality assurance, and then that's the larger set of methods used to guarantee quality patient care. It includes methods used for patient preparation and collection and transportation protocols. Both QC and QA are included in total quality management, and this is the entire set of approaches used by the institution. Continuous quality improvement is the major goal of the TQMs. All right, so here's your first question. Let's use the chat if you know the answer. Okay, let's see if we're right. It's QA. So everybody got that right. Awesome. Okay. So QA programs are mandated by Joint Commission. So they are mandated by Joint Commission. The Joint Commission standards requires that a systemic progress be in place to monitor and evaluate the quality of patient care. Joint Commission stresses the collection and analysis of data to understand where we might be weak and what we need to do to focus on improving, okay? The organization that mandates quality assurance programs is? Okay. Joint Commission. Good. All right. So the TQM, or the Total Quality Management, focuses on gradual, continual improvements in the quality of services provided by lab. Rather than merely setting a minimum standard to be met, its philosophy sees the potential for improvement in every area, okay? For the clinical lab, the customers are the patients. So when you are taking blood from a patient, that is the customer, okay? The physicians and other healthcare providers who order the test are the personnel who, let me see if I can get that, the results to provide treatment, okay? The QA guarantees quality patient care. QA programs use written documentation to set standards, to monitor compliance with written procedures and track patient outcomes. In the event of a problem, documentation provides a means of monitoring the actions to resolve the problem. QC is a part of QA. Together, QC and QA help to ensure quality patient care. QC requires documentation, equipment inspections, and calibrations. It helps monitor the protocols used in each step of phlebotomy, from patient preparation to identification through collection procedures. Okay. So then there's a procedure manual. There should be a procedure manual that is in all departments. It contains all the protocols about tests to be performed, including principles behind the test, the purpose, what you need to do for the test, the methods, and equipment and supplies that are required, okay? This would also include what we were talking about before we started today about the appropriate PPE to do with each collection, okay? The Directory of Services contains a variety of information pertinent to the smooth coordination of nursing staff and laboratory personnel. It includes laboratories test schedules, early morning collection schedules, written notifications of any changes, information on patient prep, specimen types, and handling and normal values. So it could be hard copy or online. Let me see if I can move this so you can see. All right. Laboratory document that contains information about the principles underlying testing and other protocols are. Okay, well, let's see what we got. Procedure manual, okay? So the procedure manual contains information about principles underlying testing and other protocols. All right, so what's the document that contains information about the schedules, the patient preps, and how to handle specimens? All right, let's see what it is. Oh, we got another one. Let's see. All right, let's see if we're right. Directory of Services, okay? So the Directory of Services gives the information about lab schedules, how to prep the patient, and how to handle the specimens. All right. So, variable. Any factor that can be measured or counted that affects the outcome of the test. Okay, so we really need to know the difference between what a variable is, a pre-analytic, a analytic, and a post. Okay, so a variable is any factor that can be measured or counted that affects the outcome of the test. A pre-analytic occurs before you do the test. Okay, so what is leading up to the test? So pre-analytic occurs bore analysis of the specimen. The analytic occurs during the specimen analysis, can be affected by the pre-analytic. So it can be affected by what you do before you collect the blood, okay, such as like the collection time or the transport. So if you've transported those tubes upside down, that would cause the analytic to be altered, right? Now, the post-analytic is delays in reporting results or improper entry of results in the data bank. So you've got the lab, so you did everything you needed to, you took it down, and during this analytic phase, it all went fine, but then somebody didn't put it in the computer fast enough, okay? Or they put it in the computer, the results in the computer with the wrong results. That's a post-analytic, okay? This also might be a responsibility that you do at some point. Monitoring of the variable is performed and documented to ensure that the impact of the test is minimized. The phlebotomist is most responsible for the pre-analytic. So you guys are the ones that go to the patient, you get the right tubes, you get the sample, you did it on the right time. So that's pre, okay? The lab itself is when they're analyzing the blood that you brought to them. And then the post is when somebody hasn't put it into the data bank the right way. Does that make sense? The most thing that you're going to be responsible is the pre. So variables can be controlled, include duplicate or missing requisition forms. So somebody printed off two different phlebotomists drew the same blood from the same patient. So that's an example. Okay, so there's been two requisition forms. Or somehow there was not one printed out and we missed a lab. Okay. Also tests that weren't put on the requisition form. Some missing patient number on the form, missing doctor name, or priority not indicated. So if it was a stat lab and somebody wasn't put on the lab's requisition, and you just took it down there normal time, that would alter the result, okay? QA procedures for these variables include recording and counting the numbers of each type of requisition error. So hospitals keep track of errors. They have to keep track of that, okay? Pre-analytic variables occur in each area of the phlebotomist's duties, beginning with the test ordering and the requisitional handling. Requisitions must be accurately and completely filled out with the patient's number, test order, and priority. When demographics, diagnostic, and insurance information is omitted or is inaccurate, there is also a delay in the reporting result, which introduces something with a problem with the post-analytic. So if something like let's say the insurance information isn't on there, there might be a delay in that lab result being posted, because they have to find all this information. And so that's an issue also. Okay, let's find what this question is. Occur during specimen analysis, can be affected by pre-analytics such as collection time or transport conditions. So which one of those are we talking about? So that was analytic, okay? That one was analytic. Which one are you guys most going to be responsible for? Which phase? All right, let's see. Pre-analytic, okay, so B. Okay, so equipment. Phlebotomy equipment is designed and manufactured to be free of defects and minimize variability. Nonetheless, errors do occur, and it's up to the phlebotomist to identify and eliminate them before they interfere with patient care. Remember, we always need to check the tubes for expiration dates because that can alter the test. Never use a defective needle or one from a package where the seal was broken. Stoppers should be checked for cracks or improper sealing. Tubes may be loose, vacuum without any visible sign of defects. So if you use let's say you use the tube and it doesn't really pull the blood out, you may have to change the tube out because that somehow the suction has been depleted. Needles should always be checked for defects, and syringe plungers must be free in the barrel. Tubes need to be checked for a lot number and expiration date. Like I said, never use an expired tube. Again, the tubes will lose their vacuum without any visible sign of defect. And when filling a tube, be aware of incomplete filling because of loss. So you start drawing the blood and it just is not vacuuming. So that's a defective tube. All right, what's this say here? It cannot be emphasized too strongly that proper patient identification is the most important part, right? So you've got to make sure you identify the patient of all most importance. Improper identification can lead to injury or death. A delta check is a QA procedure that helps spot identification errors. Proper identification is made when the patient's number on the requisition matches the number on the patient's identification band, and that band is attached to the patient. The delta check compares previous patient results with current results. If the difference, meaning the delta between the two sets of results, is outside the limit of expected variation, it alerts the lab personnel of a possible error. So remember, if you go to a patient's room and they don't have a bracelet on yet, you must go back up and get that nurse to put that on the patient, right? You're not going to assume that the patient's telling you that who they are. So make sure in a hospital setting that goes on. All right, here's another one. I'll tell you, it might be easier if you just do 1, 2, 3, and 4 for me, rather if you don't want to type it in. What do you guys think? Improper identification of the patient is considered what type of variable? What do you think? Okay, so it is pre. So it's something that you as the phlebotomist need to make sure of even before you start, right? So it's a pre-analytic. All right, the patient's physical condition at the time of collection has a significant effect on the sample. You have little control over most of their variables, for the test result, but things like posture, a sample collected from an erect patient, so a patient sitting or standing straight up, have higher concentrations of large molecules such as enzymes and albumin, as well as white blood cells and red blood cells, compared to somebody who's lying down, okay? Short-term exercise can increase the levels of muscle enzymes such as creatine kinase, as well as white blood cells. And let me move this guy again. My mouse is just not wanting to move today. All right, let's get him out of here. So things like creatinine, white blood cells, and fatty acids can be also changed when somebody exercises. So those are things that we can ask about when we do that. All right, a blood sample. Got way too many things going on here. Okay, a blood sample collected from a patient who is standing up will have a higher level of what?
It's still on the patient preparation slide.
It is?
Yeah.
Mine is not. Huh. That's weird. All right, see that? What do you got?
No, we can't see it.
You can't see anything?
Like we see the same slide, like the yellow, like patient preparation.
Okay, that's what I was talking about. So now do you see it?
There's no question. It's
What is going on? All right, let's see here. So you don't see this.
no.
No.
What is happening? Oh, okay. Well, let me tell you what the question says. I don't know what's happening with it. A blood sample collected from a patient who is standing up have higher levels of what? Albumin, calcium, creatinine, or urea? What do you guys think?
I read it.
That's okay. It's albumin. Albumin. Now what do you see?
The same thing.
You see patient preparation?
Yeah, with the posture and short-term exercise.
Well, I don't know why that's doing that. Oh, I see. Now?
Now it's your screen. Now it's a little screen.
Oh my goodness. Let's see here. Okay, let me do something. New share. I'm just going to go right here. See if we can get back on track. Now what do you got?
It's the top of your PowerPoint.
Ah, there's the PowerPoint. Let me get rid of that.
All right.
Huh.
Now it shows the screen where you are minimizing now.
Hold on. All right. What do you got there?
Patient preparation, long-term exercise.
It's working. Oh, all right. Let me go fast forward. That is so weird. Watch me pass it. And it just randomly did that. We're getting close. There's a question, right? All right, so that's albumin. All right, long-term exercise. Okay. All right, so long-term exercise. Just as short-term exercise can alter, long-term can increase sex hormones as well as many other values, okay? Medications and medical treatments can alter things. Things like aspirin, will increase bleeding times. Other treatments to be aware of include somebody who might be on radiographic dyes, blood transfusions, IV fluids. These can all alter everything. Anticoagulants like Coumadin or warfarin can also cause prolonged bleeding after your puncture site. So these are things to just be aware of. Alcohol, it can alter, it says, although moderate amounts of alcohol do not affect test results, except for the alcohol test, glucose is slightly elevated, and chronic consumption. So if somebody may be an alcoholic, this can then lead to liver function tests off and platelet tests off. Now, smoking can increase catecholamines, cortisols, white blood cells, hemoglobin, all sorts of stuff. And smoking also can affect, and this makes sense, right? Arterial blood gases. So they're going to be altered. Stress, anxiety, crying. So remember when we talked about infants, when you're doing their health sticks, or even children, crying for a while can alter blood levels. Things like stress hormones, like from the adrenal cortex, it can alter ABGs because if they're crying or hyperventilating, they're blowing off CO2. And it can also actually increase white blood cells. So somebody who's upset or hyperventilating and crying, it may look like they have an infection when they don't. All right, diurnal variations are certain specimens must be collected at specific times because of changes throughout the day. So let's say we're doing hormone levels, especially women's hormone levels, they change throughout the day, all day long. So it may be specified for a certain time for them to be collected. Things fasting, of course. Prolonged fasting increases the bilirubin and fatty acids. A fasting specimen should be taken 8 to 12 hours after the last intake of food. A patient not in the fasting state may produce a lipemic sample in which the serum or plasma appears turbid. It's the phlebotomist's responsibility to find out if the person stuck to fasting. Okay, so make sure that they did not eat in the last 8 to 12 hours. Also, caffeine, like coffee, tea, and soda, must also be avoided with fasting. And caffeine causes a rise in blood sugar levels. Okay, so even if you think that just drinking a cup of black coffee the morning when you're supposed to be fasting, that can alter things. All right, age. Age can change things. So values affected by kidney and liver function are different for people who are older. And so yeah, it'll alter it from the elderly patients versus a younger person. Okay, so if you happen to go out to Colorado and drew somebody's blood and they were up in the mountains in a high altitude, it's going to change things up, like the red blood cells. Athletes, so like Olympic athletes, will actually go train in higher altitudes, like in Colorado, so that when they go and do their competitions, they actually have nice, pure red blood cells that help them as an athlete. So things can be altered in altitude. Okay, cholesterol and triglyceride values increase with the age, so remember that. Sex hormones may rise or fall also as we age. Red blood cells and white blood cells are higher in infants than adults. So I'm going to say that one more time. Red blood cells and white blood cells are higher in infants than adults. It's important to make sure that the patient's date of birth be documented on the form. And here's what I was talking about. Patients living in mountain regions have higher counts of red blood cells, hemoglobin, and the hematocrit. Okay, dehydration. So if somebody's had a bout with vomiting or diarrhea, there would be some differences in their electrolytes would definitely be off. Normal ranges of analytes differ from males to females. Hemo concentration produces a false increase in many analytes, including red blood cells, enzymes, calcium, and sodium. Males, for example, have higher hemoglobin, hematocrit, and red blood cell counts than females. Pregnancy, the changes that occur in pregnancy affect lab. The presence of fetus and the increased water retention causes a dilution effect in that might give us a false lower hemoglobin and red blood count. All right, let me move this little guy here. Can you see the test? Okay, blood levels of which of the following often increase with age? All right, let's see what it is. Whoops. Sorry, I went back 2 of them. All right, hold on a minute. It's cholesterol, okay? Cholesterol and triglycerides. So that increases with age. Which of the following medications causes a prolonged bleeding time? Aspirin, okay? Aspirin will cause an increased bleeding time. All right, site selection. Sites that cause specimen contamination include hematomas or areas with edema and the side of the body that has undergone mastectomy or a current IV receiving IVs, okay? When a patient complains of stinging, pain, tingling at a near puncture site, immediately stop the procedure and find a more appropriate site. The phlebotomist has almost complete control over the variables that arise during specimen collection. Sites that you should prevent from taking are, remember, burns and scars. You don't want to be taking that over those areas. Any kind of previous puncture site, you don't want to kind of use the same site over and over. The arm near a mastectomy, sites near a fistula or a shunt, and the back of the heel or other regions close to a bone. In addition, accidental puncture of an artery during a venous procedure or use of an artery for routine collection carries a significant risk for infection. So these are all things that can alter and cause a problem. Okay, so tourniquet application. Tourniquets, now we're going to review this stuff. You guys have already learned this, but tourniquets should be left on no longer than 1 minute, right, to reduce hemoglobin concentration. Once blood flow is established, the tourniquet must be released. So once you start collecting that blood, you can release the tourniquet. Remember that if you apply the tourniquet too tightly, it can cause petechiae. You guys remember what that is? It's that little fine red dots? Okay. Hemo concentration causes false increase of large molecules such as proteins, cholesterols, and the false decrease of electrolytes like chloride. Okay, so proper cleaning reduces the risk of infection. Blood culture collections require special care to prevent contamination of the sample. As part of a QA program, microbiology departments keep records of blood cultures contaminated with normal flora. Iodine must be removed from site after collection because it can irritate the skin. So if you've used iodine to collect blood, you're going to have to clean that off afterwards because it can cause irritation in that person's arm. Iodine, also remember that iodine interferes with bilirubin test, uric acid test, and phosphorus test. Specimen collection. Specimens must be collected in the right tube for their test order and in the right order. So I'm going to keep hammering at that right order until everybody has it perfect. So keep practicing, girls. Keep looking at those cards you made, okay? So sample volume must be matched to the quantity of additives in the tube. Tube size should be chosen to provide adequate volume for the test. Labeling, we've talked about that. We've got to get everything on there. Incorrect, incomplete labeling can make the specimen useless. The specimen must be mixed gently and thoroughly after being drawn, and label tubes immediately after they are drawn, before leaving the patient's room. Okay, so don't grab those, go out to the hallway, and then label. You do that right as soon as you take the blood. Patient's perception of the level of care he or she receives is directly affected by the skill, professionalism, and care you show as a phlebotomist. Okay, so this is kind of my little rant that I had before we started today. You guys are representing professionals, okay? Even though you're students, patients want to know that you know what you're doing, okay? So when in doubt, you always ask for help and guidance. That's why you're in school, okay? It's okay if you don't feel comfortable, even if you do feel comfortable, until you know that skill perfectly, have Teresa there with you, okay? It's okay. There's only 3 of you. She can spread out and run around helping you guys. Just so please don't feel like you can't ask her to be there with you. All right, so you should strive to avoid painful probing. So you're not going to stick that needle in. I've had that done, and I'm sure you guys have had that done where that phlebotomist is digging like this. Try to avoid that. Hopefully you don't have a whole bunch of unsuccessful punctures, but there are times you are going to have to do it again. That's normal, okay?
Emily said her screen froze.
Emily did?
Yeah. She sent it to the group chat.
Well, she is muted. Let me unmute her. Okay, there you are, Emily. Can you see us?
I think it's good now. Yeah.
Okay, all right. So remember, this perception reflects not only on you, but the entire lab. So as a student, if you are perceived by patients as being, not knowing what you're doing, it's going to be perceived on our program as that too, okay? So break the chain of infection by performing hand hygiene upon entering and leaving the room and wearing gloves during your procedures. In addition, infection control procedures must always be followed. Again, that's something you guys are going to have to keep looking at. Okay. Accidental puncture with a used needle must be reported immediately. So you get that blood draw and by mistake you stick yourself, you need to report that. Do not hide that because that's so dangerous for you. QA procedures include monitoring the number of accidental punctures, so they're tracking that also. Immediate and follow-up testing for blood-borne pathogens and counseling will be started right away if you do happen to puncture yourself. Transporting the specimen, okay? Include the method of delivery, the treatment of sample during transportation, and the timing. So if that sample was supposed to be down there in 30 minutes and you got it down there in 2 hours, that's going to be a problem. That's going to alter the variable. Samples requiring either cold or warm temperature should, during transport, must be placed in the appropriate container. So we learned all about that. So again, that can alter the variable. Now remember, no more than 2 hours should elapse between the time of a specimen is collected and the time serum or plasma is separated from the elements. After this time, the sample will begin to show false lowered glucose and elevated potassium and lactate dehydrogenase. Ammonia samples must be separated within 15 minutes of collection. The exception is for samples collected in a serum separator tube, which are stable once they are spun and good gel seal is in place, okay? But rule of thumb, no more than 2 hours. And some are less than that. Centrifuge maintenance. Centrifuge must be calibrated every 3 months. Remember that, every 3 months to ensure that they are running right. Variation may indicate the need to replace worn parts. Spinning samples below the required speed may result in incomplete separation, and it may affect the test. Evaporation and contamination. Specimens should not be left uncovered. Evaporation of liquid, especially from small samples, can affect ABGs, alcohol, ammonia. Contamination may occur while the sample is uncovered from arising from airborne dust or talc from your gloves. Contamination may also occur from incomplete separation, such as when red blood cells are left in the sample after incomplete. Then there's that whole thing with refrigerators and freezers. Fluctuations in cold storage units can degrade sample quality. So they will check. There'll be a way to check the temperatures in the refrigerators and freezers. Every day they have to check those temperatures to make sure that they are staying where they need to be. Okay, so somebody will be responsible in doing that. Temperature readings that are too high or low indicate the unit needs maintenance or replaced. So that can cause an analytic issue. Specimens with different additives should never be combined in a single one, okay? Multiple aliquots prepared from a single specimen allow different departments to share a single sample for multiple tests. Each aliquot must be properly labeled as the source and the additive. Okay, back to the analytic variable. Is any variable that affects the testing, right? So analytic variable means anything that's going to affect the testing. Although most samples are tested by medical lab scientists, medical technologists, phlebotomists may train to do certain tests. If pipetting or reagents is required for a test, improper pipetting technique may yield false negatives also. Okay, so post-analytic variables are things that are happening after they have been analyzed, okay? The phlebotomist may be responsible for reporting POCT results that he or she has performed. You guys remember what POCT is? Those are things that you can do at the bedside, right? Those are little immediate results, okay? Before a result is reported, it must be interpreted and being valued. So a delta check, which we discussed earlier, helps ensure that. So remember, when you're doing, let's say, a glucose monitor, you're going to be doing a calibration every time before a patient. That's what that means. The method of delivery is determined by facility. It may include telephone, fax, computer, and hand delivery. All right, here's one. How often should centrifuges be calibrated? every 3 months. Okay. All right. So on your own, you're going to review the questions at the end of the book. Okay. Make sure you do the Kahoots. Make sure, I think you guys have already, all of you have done the test bank, so that's good. But I've got those Kahoots that are on your, that I sent to you. Make sure you're doing those. And review the, I would review those questions at the end of the book. All right, Emily, do you have to leave? Because we're going to do 19.
He has to be at work at 4, so.
All right, let's see what we can do, okay? All right, let me get a new share here.
It doesn't seem like chapter 19 is very long.
I don't either. Yeah, let me find out. Let me see if I can find it. 17. So many things. Okay, here we go. Okay, so we're going to do from the beginning. This is legal, yeah. So this isn't much. You guys have really actually learned a lot about legal. So I'm not going to spend a lot of time on the legal stuff. If you're doing your test bank, which you did, and you're doing the question, reviewing the questions at the end, and then I think I did post some Kahoots. I think you'll be fine. Okay, so let's get through this one pretty quick. I thought the same thing, Emily, when I was doing this one. So, all right, here we go. Why do we have to know all this stuff? Because it costs a lot of money to get the equipment needed, and if we have to keep throwing out, your samples, we're going to cost the hospital a lot of money. Plus, the patient's not going to be happy because you have to keep going back. So we need to know the way to do things and the right way to do things. So the availability of sophisticated technology has meant that more doctors order more tests on more patients, and that more patients expect them to order the test. So with people knowing more about medical care, they are actually being more proactive, and they are getting tests to do right here. It's like defensive medicine. So we're doing a lot of things to make sure that we don't get sick. That's a good thing, okay? The level of care expected by patients, though, has grown. So the more they know that's wrong. Okay, so that's why we need to know what's right and wrong, and we need to be aware of things that we can get in trouble for. Okay. When you need a hospital care, your doctor, nurses, and professionals are committed to working with you and your family, right? So they expect high quality, they expect clean and safe environment. They expect involvement in their care. They expect privacy. So HIPAA is very important. You're not out in the hallway talking about the results. You're making sure that everything is private. They expect to have help when they leave the hospital and help with their billing claims. We all do, don't we? Okay. So we're going to kind of go, and really the things that I want you to know are the things I yellowed again. Okay. So if you can see the yellow, right? I just want to make sure, because there's a lot of stuff in here that we've already learned a long, long time ago. I'm more concerned that you just kind of know some of these things. Okay, so statutory law is created by the legislative body. It's made up the Senate and House of Representatives. So it's at the federal level. So statutory law is federal level. Case law is determined by court's decision and its interpretation of existing laws. Administrative law is created by administrative agencies such as the IRS or OSHA. So that makes sense. Laws are also classified as either public or private. When a public law is violated, the offense leads to criminal action, and the violator is prosecuted by the public in the person of the government's attorney. The offense may either be a felony or a misdemeanor, depending on how serious it is. Okay. Phlebotomists can be charged with violations of public law. Failing to obtain informed consent from a patient. So before you just go in and take their blood and you don't get consent, you are failing to obtain information, so you can be charged. Okay. Therefore, blood must never be drawn without first obtaining consent. Got that? Big no-no. All right. If a patient refuses, and we've already gone through this, but if a patient refuses to have his or her blood, the phlebotomist must not attempt to force the patient to comply. Do you remember what we do? We report it to the doctor or the nurse, right? Okay. So to persist, so if you continue to persist and push it, you could be charged with an assault. Okay. Assault is unjustifiable attempt to touch another person. Okay. Or even to threaten to do it. So this Joe Smith says no way, and you go ahead and grab his arm and say yes way, you could be charged with assault. Okay. Battery is the intentional touching of another person without consent. So assault, you could just be threatening to touch them. Battery is you actually touch them without their consent. Okay. There are situations in which the person whose blood is being drawn is not the person whose consent must be obtained. So for instance, if it's a child, mom and dad, or whoever their guardian is, they're going to have the right to consent. So they might be screaming in the corner, and it's okay that you draw it if the parents have given consent. Okay. For instance, my mom who had Alzheimer's, you know, if I gave legal consent and she said no, she still would have her blood drawn because she could not make decisions on her own. So there are those situations, okay? But if there is any doubt about who is entitled to give consent, always ask the nurse or the physician before drawing. Just real quick, I'm not going to go through all this again, but a tort is defined as any wrongful act that causes harm or injury to another person. They can be intentional or unintentional. An unintentional tort are the basis for most medical malpractice suits. Okay. Let's see if I really want to go through any other thing. A patient. Okay, that's it. Settlements and judgments. So in and out of court settlement, the two parties reach an agreement without intervention of a jury. Okay. When the parties cannot reach an agreement, the case goes to court for a trial and judgment. A judgment against the defendant in a civil case usually results in a fine. Almost all civil and criminal actions are settled out of court, so that's good. When a civil case is settled out of court, the settlement often includes a condition stating that neither party may discuss the amount of the settlement. Okay, so if you happen to have this happen to you, and let's say Joe Smith gets $100,000 because you grabbed his arm, you can never talk about that again. Okay. That's what that means. Judgments in either civil or criminal actions must be appealed if the losing party feels that the judgment was an error. Okay. Liable means that you are legally responsible for an action and can be held accountable for its consequences. So that means you must only perform procedures that you are properly trained for. Okay. So again, if you're going into somebody's room to do something that you really haven't had any hands-on training, get somebody to help you. So you got to remember your scope of practice. All right, let's just talk about negligence. Is the failure to perform an action consistent with the accepted standard of care? Okay. Phlebotomists violate the standard of care if a dirty needle is not properly disposed of and is used on another patient, okay? Or if the phlebotomist probes during the venipuncture to find the vein and damages nerves without improper drawing technique. So if you go in there and you don't use the proper technique and you just start jabbing around, you could be negligent. Malpractice is the delivery of substandard care that results in harm to the patient, okay? Sometimes called medical professional liability. A malpractice suit usually names one or more professionals involved, and the suit would allege that there was professional negligence that caused harm. Civil suit, the plaintiff will ask for damages and money compensation. Punitive damages may be awarded to punish the defendant, usually for a gross violation of accepted standards of care. Okay. Duty, plaintiff must prove the defendant owed a certain level of care. Dereliction revolves around the accepted standard of care and the action or inaction of the plaintiff. Injury, there must be proof that a legally recognizable injury occurred to the patient. And direct cause, there must be proof that the injury was a direct result of the defendant's actions or inactions. Okay? For example, a phlebotomist does not follow the procedure for identification and the wrong patient was drawn. As a result, the patient receives the wrong unit of blood. So you drew blood on the wrong patient and they brought O negative, or let's say A positive, and they needed A negative or something like that. That is direct cause. All right. So each institution has its own protocols for these kinds of incidents. So you would learn that as you were going in a new place. Patient communication is always an important aspect of preventing malpractice claims, okay? So listen to your patient. You know, if your patient tells you you're doing something wrong, if that patient says that's not how somebody's doing that, listen to that, okay? Usually if a patient's been in the hospital for a few days, they know what's been going on and what's not. Don't just say, well, that's how I do it or whatever that response would be, okay? Remember, they're the customer. Always explain the procedure you're doing. We've talked about that. The only time nonverbal consent is acceptable is in cases in which immediate action must be taken to save the patient's life. So you might see a lot of that maybe in the emergency room or ICU. You know, if there's immediate need, there may be more lax on something you can do like that. The only time nonverbal consent is acceptable is in cases in which immediate action must be taken to save the person's life. Okay, and that's called, let me back up, that's called implied consent. Remember that. So something that could save the person's life immediately is called implied consent. All right, liability insurance. So if you go to work for a hospital, most phlebotomists are usually protected by their employees' liability insurance. Now, that doesn't mean that you may feel safer to get a little bit of your own. And that depends. Like a lot of nursing, you know, they'll be covered, but they also cover themselves. So that's something you think about. But most places you'll go to, you will be covered. Okay? Phlebotomists are bound by both legal and ethical responsibilities. Privacy of medical information is very important, like we talked about. Privacy of medical information has taken a legal ramification as well. So it is extremely important to maintain confidentiality. HIPAA defines a set of standards and procedures for protection of privacy and health information. Again, we talked all about this. You cannot disclose anything about that patient to anybody except if you're talking to the nurse, of course, right? And this includes things, so PHI is any part of the patient's health information that's linked to them. So their date of birth, their name, the address even. Never discuss a patient's condition in public, on an elevator, in the hallway, at lunch, okay? Never discuss information concerning a patient with someone not involved in that patient's care. So somebody on, you guys are on what, 3? So somebody downstairs on 2 that has nothing to do with that patient, you don't talk to them about it. Just because they're part of the hospital doesn't mean they have, they can receive any information about a patient that they're not involved with, okay? Never release medical information concerning a patient to anyone that is not authorized to acquire it. Another thing, don't leave patient records out where patients or visitors can glance at it. And always log off your computer when your task is done. All right, we already talked about that. All right, so that's that. Again, you can unmute yourself there. So you can take a look at all these. You guys did your test bank, your Kahoots and all that. So make sure you're doing that for the next 2 days, okay? I'm gonna go ahead and review 16 real quick for anybody who wants to stay. If you have to go, Emily, I understand.
I still have time. It's okay.
Okay, let's do this. I'm just going to go through the questions real quick so we can. I'm not going to ask you guys to, let's see here. Let's just do it as together, okay? All right, so how many times should a tube of blood containing an anticoagulant be spurted? You can yell out answers, you can see it. It's
5 to
5 to 10, right, 5 to 10. I think that my mouse is about ready to die. I can't find my, come on. Oh my goodness, where did it go? We're going down. Here we go. We'll just do it that way. All right. The label printer is broke and you must handle labeling, which is not required on the label. Do you remember?
date of birth.
What is it?
Date of birth.
Date of birth. That's right. All right. Another one. Whoops. Tubes must stay upright during transport for all but.
Slows.
Yep. Slows down the metabolic process. So remember that. You, yeah, just remember it's going to slow it all but slowing down the metabolic. Oh my goodness. Okay. All right. Which of the following tests is most affected by glycolysis in the tube after collection?
Glucose.
Glucose. Okay. What is glycolysis?
Breakdown of sugar.
Breakdown of sugar. What's the maximum time to deliver a specimen to the lab?
45.
45 minutes. Right. Now, the CLSI states the max time before cells separate from plasma or serum is
2 hours.
2 hours. Okay. What anticoagulant tube can be sustained at room temperature for 24 hours?
Sodium fluoride.
Sodium fluoride. Blood smears from whole blood must be made from the tube within what time?
1 hour.
1 hour. Which sample does not need to be protected from light?
Calcium.
Okay, so remember that, girls. Bilirubin breaks down. Carotene, which is, I always think of carrots, so carotene breaks down, and folate. So calcium does not have to be protected from light. Oops, little happy there. All right, a unique identifying number used for cataloging samples is referred to what number?
Adequate.
What is it?
Extension.
Accession, that's right. Wonder why that's not lighting up. Okay. Before dividing a 24-hour urine sample, what must be done with the sample first? It's going to be measure and record the volume. So for 24-hour urines, before you sample it out, you're going to measure it and record what that person collected in 24 hours. Okay. The phlebotomist had difficulty getting an EDTA tube for a CBC and SED rate. So the person had 2 underfilled tubes were collected. What should the phlebotomist do?
Reject it.
Reject it at the bedside. So you're not going to mix two half-filled to make a nice, pretty full one, right? No. Reject it and do it again. All right, that's all on that one. Let's do a new share here. So that was 16. If I have 17 up there. What's this? 19, 18, where's 16, 17? What's this one? Maybe that's 17. Not sure if that's 17 or not. Let's see. See if I can get it.
Oh gosh, my dad's calling my mom.
Mm-mm.
He's not used to having me having my mom's phone. I had to decline it.
Oh, yeah, I bet. I'm trying to find it, girls. I can't seem to find 17. I know it's up somewhere. All right, I'm going to minimize you guys for a second and find it. There we go. All right. All right. What are you seeing right now?
Chapter
Point
7.
of care testing.
All right. Point of care testing. Awesome. All right. All right. What's another name for point of care testing?
Alternate.
Alternate testing. Right. Which is necessary in a patient's home, but not necessary in a hospital.
Carry yourself in for emergency.
Absolutely. Which agency decides if a test is CLIA waived?
FDA.
FDA. That's right. Okay, a portable instrument for a simple, fast method of testing for anemia. Measures which of the
Hemoglobin.
Yeah. So remember that the best way to think about that is anemia is, we're talking about red blood cells and et cetera. So I don't know if that helps or not, but hemoglobin is red blood cells too. Bedside glucose testing is rare. False, right? You're going to see that all the time. C-reactive protein tests for inflammation. That's right, inflammation. Okay, so that was it on that one. So that was a short one too. Okay, because that was all electrocardiogram. Okay, so that's all of that. Let me get you guys over here so I can see you. All right, so here's the deal, girls. Next week I'm gone, okay? But so we really won't be doing face-to-face, okay? We will be doing, I have already started posting some lectures. The first chapter is on your own. It's a lot of anatomy and stuff, physiology stuff. So really the best thing for you guys to do is, and I've put an outline, and I think for me, it looks like if I was learning it, I would follow that outline. It tells you like to read this page to this page, and then it refers you to go to the back of the section and look at the questions and go back and forth. I would really highly suggest to do it that way, because that chapter is just filled with there's a lot of stuff there. Now, are you going to have to know the details of this stuff when you're out there doing phlebotomy? But if you guys are going to take the certification test for the phlebotomy, okay, you are going to have to know this. So I think the best way to get through that chapter is just to do it that way and do the test. The test bank is huge. I looked at it. It's a big one. So don't wait till Tuesday deadline to do it. Okay. That's the best way to do that. Chapter 2, it is again was like 122 slides. Yeah, that's what I said. Rebecca, that's the face I made. So I was overwhelmed to teach you that because that's a lot of information. I broke it up into 3 different videos. Okay. I broke it up into, so you'll see on the board that there's 3 different PowerPoints to watch. Okay. I think for me, it was a lot simpler to do that. And once I did it, I was like, oh, I get it. On there, you'll see some practice slides because I do want you to do your assignments at the end of the book because there's a lot of test strips to look at and try to get familiar with them. Again, are you going to read those with are you going to have to know every little bit about those strips? No. Are you going to have to know some of this stuff for your certification test if you take the certification test? Yes. Am I going to test you on the details? No. You get it? So if you are going to get certified in in EKGs, you're going to have to do a lot of studying for that certification. Okay? That's going to be a lot of stuff on your own. If you want to get through this class, you're going to be fine. Because I'm not going to, you're going to have to know some stuff, and I'm telling you what to know. Okay? But chapter 2's up there also. Again, don't wait till the last minute to do those test banks because it looked pretty heavy too. I've really been working on making our own Kahoots. Thank you, Rebecca, I like Kahoots, so thank you for that suggestion. I think it's helping. Do you girls think it's helping? I know, Meredith, you're doing them like crazy. That's good. And don't just do them once. Don't be happy with that score because that's not going to really help you get better to take my test, right? Or be ready for the exam. So work on that. You've got a few minutes at lunch, just pull it out and start working with it. And I think it helps. I will be working a little bit today and then sometime this week to get the other 2. There's going to be 4 PowerPoints, 4 chapters that we need to do next week. But you guys are going to be doing it all on your own. There's no test next week. Okay. So we have a test Thursday, but there's no test next week. But there's a lot of busy work to do. Okay. I also put up what I call, and I like these, I put up a YouTube video already, and I'm going to find a couple more. I don't want to say that dummies down the information because that sounds kind of bad, but for me, it helps me to simplify what's in this book. Because I think that when you start looking at this stuff, it's going to look a little overwhelming. Okay. And that's okay to feel that way because it's a lot of information. It's a lot of stuff that I don't think that you're going to really be using a lot of. It's good information. I'm not saying it's not, but there's a lot of stuff that just to be drawing blood and just to be doing EKGs, you just have to do it for the certs. If you're going to do the certs, now it's not written in stone that you're doing the certifications. I hope you do, but anyways. So I'm trying to break it down as much as possible, but you got to put some work into it, I think, to get those certifications done. So I will work on chapter 3 and 4 and get those up online too, but I've already given you enough to work on for next week to get started because there's a lot of busy work. Okay. You guys have any questions?
Do you still want us to screenshot the Kahoots?
That helps me, but I think that I've kind of worked through and figured out how to actually perfect those challenges so I can see them better. So I can actually go to it works better on the computer for me to pull up the results. So it is showing me results. So hopefully I've changed because I can send it to you guys in so many different formats, but I think that the way I've done it, I can see it now.
Okay, because last time I've been doing it 10 times.
I know, and that's good. That's good. I think that helps. I think that really helps. All right, girls, do you have any other questions? I'll be in contact with you guys. You can still, I'll be able to contact you and all that, but like I said, we won't be meeting face to face. And it'll be a lot of busy work for you, but you can contact me and ask me questions and all that good stuff, okay? All right. Please go to clinicals and be safe and do what their protocols are, okay, girls? And ask for help. Ask for somebody to be watching you do stuff. Ask for somebody to help you walk you through things, okay? That's what you're there to do. We didn't get much clinical time. We lost a lot of time with this whole COVID thing, so it's okay. All right? All right, see you guys. Bye.
Bye.
Bye.